The girl sent hundreds of miles away for a bed. The young man whose parents say he was discharged too soon and took his own life. They are amongst the many cases covered by Look East about the shortcomings and failures of the Norfolk and Suffolk Foundation Trust, the only mental health trust to be in special measures, and now back in them. Too often loved ones have been lost. The strain for families seeing them spiral out of control takes them to breaking point. We went back to visit Alison Gathercole, who the BBC spoke to earlier this year. Her daughter Sophie had been admitted to Helston Hospital.
She was allowed to go out because she was a voluntary patient. So she went up to Asda and she bought herself a razor blade and brought it back to the ward and then proceeded to use that on herself nearly every night during the month of February, having to go then to A&E every night and have either staples or stitches. She needed to be kept safe and she wasn't.
Sophie is now in a secure unit and is improving. If there's one positive to take from this report, it's that the overall quality of care from staff was good. But frankly, it couldn't have been more critical of the management. It said the board has failed to act on serious concerns that have been reported to them since 2014. The CQC report out today said the board had not taken action to ensure that unsafe environments were made safe. Later it states major safety issues remained unresolved. It said the board had not ensured that there were sufficient staff to meet patients' needs safely, and that the board did not have the drive to effect change, and that bed occupancy rates were high, leading to a large number of patients being treated outside the trust to being discharged early.
We rated the trust as being inadequate for both safe and well led. In terms of safety, we were worried about the physical conditions on some of the wards. We didn't think they were totally safe environments. The way the ward was laid out made it difficult for staff to observe patients who might be at risk.
The board have had so many warnings. We've tried improvement, we've tried meetings, we've tried argument, we've tried statistics. And there comes a point when changes have to be made.
Sophie is coming home this weekend for her first visit in a long time. She is doing better. Now the Norfolk and Suffolk Foundation Trust needs to. Simon Dedman, BBC Look East.